Like all Mumbaikars, Narendra Jain loves his city, driving, loud music and food, lots of it, and not necessarily in that order. A wealthy stockbroker on the rise and rise of the Sensex, Narendra is prone to stress at work and out of it. Today is one of those days, it seems. Otherwise, why this sweat on a cool December day? Could it be?
Hello, doctor.
Narendra's doctor advises him to stop driving and take a cab to the nearest hospital. If a person is aware of the signs of a heart attack and also knows what can be done until emergency help arrives, the chances of survival and recovery are far greater. The classical symptoms of a heart attack: acute and severe chest pain lasting for at least 20 minutes, sweating, nausea, vomiting, epigastric pain or discomfort in the abdomen, and breathlessness in some cases. A hollow cone-shaped muscle located between the lungs and behind the breastbone. Your heart is roughly the size of your fist. It has 4 chambers: right atrium and right ventricle, left atrium and left ventricle, each with a sort of one-way valve at its exit. This prevents blood from flowing backwards. When the chamber contracts, the valve at its exit opens. When it is finished contracting, the valve closes so that the blood does not flow backwards. The right side of the heart collects oxygen-poor blood from the body and pumps it to the lungs, where it picks up oxygen and releases carbon dioxide. The left side of the heart then collects oxygen-rich blood from the lungs and pumps it to the body, so that the cells throughout your body have the oxygen they need to function properly.
The commonest cause of the heart attack is blockades in the coronary arteries. These coronary arteries supply blood to every nook and corner of the heart muscle. When these arteries get blocked, there is a reduction in blood supply or complete cessation of blood supply. When the complete cessation of blood supply takes place, the heart attack occurs. In order to find out these blockades, we have to do a procedure. Since ordinary X-ray chest will not be able to show these blockades, we have to do a procedure called angiography. In angiography, a small ultrafine tube is introduced from the groin of a patient, and under the X-ray control, it is advanced up to the heart. We selectively put this tube in the mouth of the coronary artery and inject an opaque dye. The dye is opaque to the X-rays, and when we take an X-ray movie or a film, the blockades can be easily identified, and then the doctor studies those blockades and decides what kind of treatment should be given. Your doctor might advise you that these blockades should be treated medically. In other words, these blockades are either mild or are insignificant or unimportant. There, the medical treatment and the lifestyle modification could be enough. Sometimes these blockades are fairly severe, and your doctor might advise you a procedure called angioplasty, and sometimes the doctor might advise you a bypass surgery.
Good morning, Rohitji. How are you? Okay, baby. Much better than that day, huh?
There are certain simple measures that a patient can take in an emergency while he is all by himself at home. First, he should lie down flat, put a sorbitrate under the tongue. If the chest pain doesn't subside for 5 minutes or 10 minutes, it can be repeated again. And immediately he should take a full tablet of aspirin, 325 milligrams. At the same time, he should not panic and should call for emergency help and transportation to the nearest hospital. The patient should also be aware of some uncommon signs and symptoms which may be by themselves alone and most often usually accompany the chest pain. These are a feeling of indigestion, pain radiating to the left arm or the right arm, pain involving the neck and involving the lower jaw. The patient could have a feeling of tiredness, malaise, and generally not feeling well.
How many times does your heart beat? The average heartbeat is 72 times per minute, 100,000 times in the course of a day, or 2.5 billion times by the time you are 70. Today is another day. Will the Sensex touch 7K? Not that Narendra cares. His mood has crossed the 10K mark. He is just happy to be alive.